The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello, and welcome to Wonderfully Made. My name is Don Morgan. I'm an exercise physiologist and faculty member at Middle Tennessee State University. Someone once said, if you can find a path with no obstacles, it probably doesn't lead anywhere. Becoming physically active can lead to better health and fitness, but sometimes obstacles can get in the way of pursuing an active lifestyle. Today, we'll discuss some of the many health benefits which come about as a result of following a physically active lifestyle. I also want to point out some of the most common barriers to starting and maintaining an exercise program and identify some strategies for overcoming these barriers so that you can remain firmly on the path towards achieving the strong, healthy body that God intends for you to have. I want to begin today by taking a broad look at how our bodies respond to physical activity and exercise. This overview is based on material found in the 1996 Surgeon General's report on physical activity and health, as well as other published research. Let me start by making some general statements. First of all, people of all ages, both male and female, undergo positive physiological and structural adaptations to physical activity. In other words, being physically active is something that all of us can do to become healthier and stronger. I'd like to emphasize that these adaptations to physical activity are not restricted to younger people. It has been shown, for example, that male and female nursing home residents with a mean age of 87 years, demonstrated an average increase in muscle strength of over 100% in response to a 10-week period of resistance training. This strength enhancement was accompanied not only by muscle hypertrophy, or an increase in muscle size, but also by faster walking and stair climbing speeds, adaptations that would allow these older adults to retain their independence and mobility. Secondly, the physiological benefits associated with physical activity occur in many organ systems, including the cardiovascular system, the heart and blood vessels, the musculoskeletal system, muscles and bones, the metabolic systems of the body that are important in providing energy, the endocrine or hormonal systems, and the immune system. Third, while the body adapts in a positive manner to moderate physical activity, many of these benefits start to wane after a few weeks if physical activity levels are markedly reduced, and they can vanish within 2 to 8 months if physical activity is not resumed. This dynamic reflects a basic physiological principle. The body responds to the functional demands that are placed upon it. It can either become stronger and more fit or weaker and less fit, depending on your level of physical activity or inactivity, respectively. One of the most important benefits of physical activity is its positive impact on health and disease. While future programs will address the specific role that physical activity plays in a variety of health conditions, let's take an abbreviated look at some of the major effects of physical activity on a broad range of health problems. One important benefit of engaging in regular physical activity is that it reduces the risk of dying prematurely. With respect to overall mortality, higher levels of regular physical activity are associated with lower death rates for both older and younger adults. Even just moving from a poor fitness level to an average category of fitness can result in a substantially lower death rate from cardiovascular disease. Thus, you don't have to be a well-trained athlete to experience a marked reduction in heart disease death rate. But as we've discussed in previous programs, you do need to accumulate a minimum of 30 minutes of moderate intensity physical activity on a regular basis. Another positive benefit of being physically active is that it is a means of weight control. Increasing your physical activity level can make weight management easier by helping to prevent weight gain, promoting weight loss, especially when combined with a healthy diet, and stabilizing body weight once excess pounds have been lost. Physical activity may also favorably influence body fat distribution by decreasing fat deposits around the middle of the body, a condition which can lead to cardiovascular disease, high blood pressure, high fat levels in the blood, and type 2 diabetes. Now, we just mentioned diabetes, and regular amounts of physical activity and exercise can decrease the risk of developing type 2 or non-insulin dependent diabetes. For the diabetic with well-controlled type 1 diabetes, a condition in which little or no insulin is produced, a regular program of physical activity can result in a marked reduction in insulin requirements and improvements in cardiovascular fitness and quality of life. In those persons with cardiovascular disease and hypertension or high blood pressure, regular physical activity can lower the risk of death from coronary artery disease. Interestingly, it has been shown that the risk of cardiovascular disease due to low fitness is similar to or greater than that attributable to other lifestyle factors, such as cigarette smoking, high cholesterol, high blood pressure, and greater relative weight levels. Regular physical activity can also prevent or delay the development of high blood pressure and reduce blood pressure in people with hypertension. Regular physical activity may help to reduce the risk of developing certain types of cancer. While we will talk about this topic in a future show, regular physical activity has been linked to a decreased risk of colon cancer, and there is some evidence suggesting a possible association between higher levels of physical activity and a reduced risk of breast and prostate cancer. Regular physical activity is essential for maintaining joint structure and function, muscle strength, and healthy bones. In individuals with arthritis, exercise may be particularly helpful because it can preserve or restore range of motion and flexibility around affected joints, as well as increase muscle strength and endurance so that joint stability can be enhanced. In considering bone strength, there is strong evidence that physical activity begun early in life contributes to higher peak bone mass later in life. In fact, greater lifetime physical activity has been related to higher levels of bone mineral mass and a lowered risk of hip fracture in both men and postmenopausal women. Regular weight-bearing activities such as walking, running, and racket sports have been shown to be effective in maintaining the density of leg and spinal bones. There are also promising data indicating that the gains in muscle strength and bone health produced by weight-bearing activity and resistance training can be very useful in helping older adults improve their quality of life by helping to maintain their independent living status and to reduce their risk of falling. In addition to physical fitness, mental health is also fundamental to overall health and wellness. There are many deleterious effects of chronic stress that affect mental health, including, but certainly not limited to, an increased risk of hypertension, heart disease, cancer, early death, compromised immunity, and insomnia. In this regard, growing evidence indicates that physical activity improves mental health by relieving symptoms of depression and anxiety and by improving one's psychological state. Findings from some studies suggest that physical activity may actually protect against the development of depression. When faced with psychological stress, individuals with good levels of aerobic fitness display a lower level of cardiovascular response compared to unfit persons. There also appears to be some evidence suggesting that exercise has a positive effect on specific measures of cognitive function, especially among the elderly. What a blessing it is to be able to reap so many health benefits by simply incorporating a moderate amount of physical activity into our lives. In fact, given the multitude of health blessings that we've just talked about, it would almost be like throwing away free money by not including physical activity and exercise as a normal part of your routine. However, it can sometimes be quite challenging to find ways and create opportunities to be physically active on a regular basis. Let's look at some of the most common barriers to physical activity and see if we can identify some strategies for overcoming them. The most common excuse that adults cite for not exercising is, that's right, not enough time to exercise. Now, with a busy job and 2 children who are involved in school, church, and extracurricular activities, my wife and I often wish that there were more hours in the day. So how can we overcome this obstacle? Well, one way is to try and add small chunks of physical activity time to your daily schedule. This might include climbing stairs instead of taking the elevator, parking your car a little farther away from the office, avoiding the use of the remote control to change television stations. In other words, getting off the sofa and changing channels yourself. Taking a 10-minute walk during lunch or after your evening meal, or doing a little yard work. Remember, as we've mentioned in previous programs, it is the accumulation of physical activity throughout the day that leads to better health and fitness. Another approach to finding more time to exercise is to review your daily schedule with a critical eye trained on finding time to be physically active. You know, we make time to do the things that hold a lot of importance for us, whether it is spending time with friends, shopping at the mall, or watching Monday Night Football. If having good health is a priority in your life, then I encourage you to seriously consider rearranging the contents of your day to make time for physical activity. Another reason that people cite for not exercising is that it is inconvenient. Maybe the weather is lousy, or you travel a lot, or maybe you have family obligations that hinder your ability to exercise on a regular basis. If weather conditions are such that it is difficult to exercise outside, have a backup plan ready. This might include cycling on a stationary bicycle, doing aerobics with a tape, swimming at a local YWCA, or playing basketball in the local rec center. If you travel a lot, you might consider walking around the local shopping mall, or if you have an aerobic tape, just pop it into the VCR in your hotel room and exercise to it. Some hotels have swimming pools and workout rooms that guests can use. And if worse comes to worse, you could, as one person I know does, walk the halls and climb the stairs in the hotel they're staying at to get in some physical exercise. If you're a mother who is home with her children, play games with them that involve physical movement, or wait till they're at school or napping to sneak in some physical activity time. Another possibility might be to trade babysitting time with a friend or family member so that you can get in a short walk. A third reason for not being active is a lack of self-motivation. Now, it is difficult to motivate someone to do something that they don't want to do. So I hope that the material I've presented thus far in this series of programs has served to encourage you to find a reason to start a physical activity program. Planning ahead so that physical activity is an important part of your daily schedule, for example, scheduling an appointment for physical activity on your calendar like you would any other appointment, may help you to stick with an exercise program. Setting goals for yourself that are specific, like increasing your daily activity level to 30 minutes per day, measurable, walking 2 miles a day, and attainable, trying to exercise 5 out of 7 days, can also encourage you to stay motivated. And if you meet your exercise goals, reward yourself by buying a new warm-up suit, a pair of walking shoes, or a new exercise tape. If you enjoy meeting and interacting with other people, you might also want to consider joining an exercise class or starting a little walking club with a few friends. While it's easier to say to yourself, "I don't want to exercise today," it's harder to use that excuse when someone else is expecting you to walk with them or to attend an exercise class that you've signed up and paid money for. When scouting out exercise buddies, try to find people with fitness levels and goals that match yours so that you can progress at similar rates. Some people don't like exercising because they claim it isn't enjoyable. Obviously, you want to choose an exercise activity, whatever it is, that's fun and that you feel comfortable and confident performing. Whether it's something like running, which is a favorite of mine, or walking, or rebounding, or swimming, bicycling, or playing basketball or volleyball, or some other activity I haven't mentioned. Pick something that you like and start doing it. Some people avoid physical activity because they claim it's a boring way to spend their time. My simple response to this concern is to make exercise choices that are enjoyable and fun, and to be creative about ways to vary your activity routine. For instance, I have a friend who breaks up his weekly exercise routine by running a couple of days, lifting weights on 2 days, and playing basketball at least 1 day a week. A mix of activities that keeps him from getting in an exercise rut. Some people lack confidence in their ability to exercise, and this keeps them from being active. If you identify with this concern, then I suggest that you select activities like walking, jogging, or climbing stairs. Activities that don't require learning new skills. If you want to participate in physical activities that do require some skill, you can exercise with friends who are at the same skill level as you are, or find someone who is willing to teach you some new activities, like tennis or swimming. Keep in mind that exercise isn't a contest, and you're not competing against anyone else. Your goal, and your only goal, is to improve your health and fitness on your own timetable and no one else's. Another way to state this is that when your weight starts to drop, or your clothes start fitting a little bit better, or you feel stronger and less tired at the end of the day, then you're a winner. If fear of injury is keeping you from exercising, then start off slowly and gradually increase the frequency, duration, and intensity of your activity. Remember that there is no fast approaching deadline for attaining your desired level of fitness. Take your time and let physical activity become an integral part of your everyday routine. If you're experiencing pain when exercising, then you may be overdoing it. So slow down or check with your doctor if the pain persists. Watching Dick Nunes's show, Body and Spirit, here on 3ABN, will also show you how to warm up your body prior to exercise and how to cool it down when you're finished with your workout. The lack of self-management skills can prevent you from remaining focused on why you began an exercise program in the first place. If this is a problem, then ask yourself some questions about what you hope to achieve by becoming physically active. In other words, is your main focus losing weight, or do you want to become stronger? Is it important for you to gain more endurance, or do you just want to function better on an everyday basis? All of these goals are worthy ones, and having specific objectives to work towards can help you determine whether your physical activity program is working for you. When you first embark on an exercise program, it is vital to have encouragement from your family and friends. Explain your interest in physical activity to them and solicit their support in helping you to become physically active and fit. This type of encouragement can have a positive impact on your ability to remain committed to an exercise program. You can also invite your friends and family members to exercise with you. Plan social activities that involve exercise, or develop new friendships with people who share your interest in physical activity by joining the YWCA, a water aerobics class, or a hiking club. Community resources that are close to home or work can affect your physical activity choices. If these resources aren't readily available, then select activities that require a minimal amount of facilities or equipment, like walking, jogging, or exercising to a video. By doing a little sleuthing, you may also be able to locate inexpensive and convenient resources that are available in your community, like walking trails, parks and recreation programs, and worksite facilities that you can take advantage of. To sum up, many factors can influence our ability to stay motivated to exercise, and I've tried to provide you with some helpful advice to overcome some of the barriers that can get in the way of your pursuit of an active lifestyle. Let me leave you with some final tips to keep you moving forward towards your goal of becoming physically fit. One is to build on success. Start with small goals that lead to larger ones. For example, if walking 30 minutes every day of the week is one of your fitness objectives, then you might want to start walking 3 to 4 days a week for 15 to 20 minutes, and as you get stronger, gradually increase the duration and frequency of walking until you achieve your ultimate goal. At that point, you can determine whether you're comfortable maintaining your current level of fitness or whether you want to establish new fitness goals. Another tip that may be useful is to find a role model that you can look to, someone who started where you are and that now embraces physical activity as an integral part of their life. By following their example, you can become a role model for members of your family or friends as they watch this transformation occur in your own life. A third tip is not to be discouraged if you don't see immediate results. Just as it is a gradual process for people to become sedentary and deconditioned, it will also take some time to develop a new philosophy of living that translates into an everyday commitment to an active lifestyle. And lastly, don't forget that small bits of physical activity accumulated over a period of time can lead to striking improvements in your health. Sally lived across the street from us and was a young mother of 4 children under the age of 10. The extra weight that Sally gained during her pregnancies had never really come off, and she was discouraged by the way she looked. One day, Sally started doing some yard work, and she realized that she really liked working outside. In fact, she liked gardening so much that it became a passion for her, and she remarked to my wife that working in the yard helped her to relax. Often I would see her outside, transplanting shrubbery and tending to her gardens and flower beds. What amazed Sally, and what became noticeable to my wife, was that over the course of a few months, she started losing a fair amount of weight. In fact, she lost so much weight that she eventually reached the weight she was at prior to her first pregnancy a decade earlier. When my wife asked her if she had done anything else to lose this weight, she said no. She hadn't changed her diet or begun a formal exercise program. All she had done was to start working out in her yard. While some of you may not necessarily enjoy planting flowers or gardening, One lesson that can be gleaned from this true story is that small increases in physical activity, if maintained over time, can add up, as they did in Sally's case, to produce a brand new person with a healthier outlook on life. I also noticed that Sally found something she loved to do, gardening, and was able to incorporate this health-producing activity into her everyday routine. Like Sally, we too should aim to find activities that we enjoy and include them as part of our physical activity routine. Our ability to thrive and function well is tied directly to our health, which in turn is influenced by our inclination to engage in daily physical activity. However, some view commitment to an active lifestyle as just one more thing to add to an already full plate. From a broader perspective, being physical activity isn't really a problem. It's part of the solution to the epidemic of chronic lifestyle diseases that currently plague our nation. Just as our physical strength increases with daily exercise, our spiritual strength also grows when we seek on a daily basis to know God's will for our lives. Movement and physical activity is the currency of all living things on earth and is a constant of all heavenly bodies in the universe. When you decide to embrace an active lifestyle, you are saying that your health really does matter, regardless of how busy you are or how bad the weather is. It is my hope and prayer that you become not only physically fit and physically active, but that you also become spiritually strong so that you can build up a physical and spiritual immunity that can ward off physical ills and keep you safe from all spiritual temptation. In our next program, we'll be discussing some simple ways to monitor your progress in becoming physically active, because you certainly want to know if you're making gains and improving your physical activity. And we'll also be looking at ways that we can motivate you to improve your health status. Remember that it is important to be physically active. It is a process of the universe, and we fit seamlessly into the universal activity when we are physically active. So until next time, I want you to keep moving, step by step, towards better health and fitness. Because when you do that, your physical health improves and your spiritual health improves as well. We'll see you next time.